my name is Holly Feltner, and I'm going to be discussing implementing a change in the enterprise that I'm currently employed at regarding work-life balance. I recently took a survey through the Clark Workplace Inventory, and the results showed that the weak areas at my place of employment included wellness and self-care, work-life balance, and a lack of sufficient mental health coverage for employees and their families. So overall, the enterprise had a pretty good score. They scored 80% out of 100, which put them into the moderately healthy category. So this project is focusing on weak areas, opportunities for improvement throughout the enterprise. So some strong areas included active engagement and shared governance, nurses' ability to influence policy development, excellent interdisciplinary teamwork and collaboration, and a strong, comprehensive mentoring program for new graduate nurses. It's called a nurse residency. So, like I mentioned before, some of the weak areas were employee wellness, employee self-care, work-life balance, and mental health. So some things that are currently offered in those areas that have room for improvement are a employee assistance program that offers employees 3 mental health visits per year free of cost. So the catch is those visits are limited to 3. Many employees could benefit from much more than 3. Family members are excluded from that, whereas employees who have family coverage can include their family members on their plan for physical health. They cannot include them for their mental health benefits. So there's room for improvement there. And the employee assistance program, the 3 counseling sessions also do not cover marriage counseling. So, the proposal for change. There are 7 aspects for the proposal. The first is creating a work-life balance committee that is going to be called the Work-Life Team. The Work-Life Team will focus on increasing mental health benefits for employees and families, offer self-help options that will be available to employees during work hours. This may benefit employees that suffer patient loss, burnout, or this may be a resource for employees to seek to deal with outside stressors as well. The program will offer self-help options as well as paid maternity leave, on-site childcare, and self-scheduling. Additionally, there is a current system of paid time off that is split into different parts. So there's a certain amount of sick time. There is a certain amount of bereavement time, but that is only applicable to approved family members. So an employer is currently deciding whether or not a family member that passes away is close enough to the employee to excuse their absence. In addition to that, vacation time and holiday time are also split. So this new program, it will offer a bulk of PTO. It's going to be called Flex Time, and the employees can use it however they see fit. So to justify the changes, just a few statistics. Overall, paid leave for maternity leave improves worker retention, and in the long run saves employers money because they aren't having to spend so much to retrain new employees. And the cost of orientation is quite significant. Additionally, impaired mental health has an enormous negative effect on employees' performance and well-being. So just simply including mental health coverage in with the health insurance plan would strongly assist in improving that area as well. In addition, it has been shown that places of employment that offer an on-site childcare have less stressed employees because they aren't worried about whether or not they're going to make it across town to pick up their child in time, whether or not they're going to hit traffic. If an issue arises, the child is on site so the employee can just take a short 5 to 10 minute break, go and deal with the issue, and come right back to work. So, this work-life team, there are 3 main stakeholders, 1 being hospital administration, 2 being the employee and their family, and 3, the patients and their family. When employees are more satisfied, more engaged, it has been shown that they are going to do a better job taking care of their patients. So the benefits are going to trickle down to the patients as well. And the way that these changes will be communicated, the leadership of the work-life team, they must maintain a strong presence. They must show up to every meeting. They need to be available to the rest of the committee and the stakeholders. They should encourage team members. They should stand behind their vision and values, and they should maintain strong partnerships with the community and the available resources in order to support the employees. So anytime that we are talking about implementing a change at this level, the risk must be evaluated as well. So the work-life team will do that. They will assess benchmark institutions that have these policies currently in place. The places that have implemented similar changes, they will look at challenges they faced while doing so. They will look at cost effectiveness, and they will fine-tune the implementation plan before putting it in front of the staff. Okay. And then the references are listed at the end of the presentation.